Good afternoon, everybody. And my name is Jason Goodman, and welcome to my presentation on emotion-focused therapy today. Before I get started, I'd just like to talk about a little about what struck me about this topic. When thinking about emotion-focused therapy, I thought, well, if I'm sad, that's going to cause me to cry. If I'm scared, that might cause me to run away. So it occurred to me that emotion directly affects our behavior. And that's what led me down this path of being interested in emotion focused therapy. So let's get started. We'll start with an overview and some of the main theories of emotion focused therapy. So, what is EFT? How is it defined? Well, EFT is the practice of therapy informed by an understanding of the role that emotion plays in therapeutic change. So, how does emotion affect therapeutic change? How do we use emotion to get people better? What does EFT emphasize? Well, during EFT therapy, we emphasize awareness. How aware are we of our emotions? Regulating our affect. How do we control how we display these emotions? How is controlling our affect? How does that help in the way we actually feel? Expression of emotions and creation of new meaning from the emotions that we already feel is also a big part of EFT therapy. And transformation and reflection of the emotions we have. Now that we've transformed our emotions and better understand them, we can reflect on what that actually means. So next we'll take a look at some core features of EFT. And one that I like a lot is it makes a distinction between conceptual and experiential knowledge. That means our emotions have information. And even though conceptually and consciously we're thinking, we're getting all this information, there is also information that can be drawn from our emotions that if we access, we can then know more about the things that we're feeling. And yes, people are wiser than their intellects alone. So once we use to learn that information, we can expand on our own intellects. It implements an integrative focus on motivation, cognition, behavior, and interaction. So what motivates us? How do we think about it? How does it make us behave? And how does it influence our interactions with other people? All important stuff. And it focuses on people's emotions as a pathway to change. So let's take a look at how we feel, why we feel that way. Are we expressing everything that we feel? And how can we use that information to affect some change? Some more main concepts of emotion-focused therapy. Emotions are adaptive, which means they can become problematic for various reasons. So if we're in a problematic situation and we have made sense of the emotions we feel about it, and then that situation changes, our emotions very well may adapt to that situation, which can, I guess, become a slight setback in the work that was already done. And awareness of what a person feels is the first step to the identification of a problem. So we have to know what we're feeling. And sometimes we think we know what we're feeling, but it takes more in-depth analysis and introspection to really get a complete sense of what we're feeling. And one must feel a feeling in order to change that feeling. So again, awareness. What are we feeling? And we need to feel it before we can change it. And change will also take place when we help people make sense of their emotions. Overwhelmed is a common feeling. And being able to slow that, I guess, tornado down and try to break your emotions apart and make sense of them is definitely a core feature in EFT. And it also has an integrative view of motivation. So many things are guiding our experience. Maybe not just the thing we're talking about in session, but maybe there's other things in our lives coming from all different directions that are motivating us. So it's good to take a look at not just the problem at hand, but what else may be happening in a person's life. So where does EFT come from? It was born and grown in response to the overemphasis of cognition and behavior. So we all know that CBT is a very popular concept and that behavior is seen as a very important thing to focus on when it comes to therapeutic change. But like I spoke about earlier, emotion influences behavior. So, the school of thought was, okay, we have this emotion that influences behavior. We need to take a look at this. And we need to see if it's more effective than CBT, equally as effective or less effective, so we can know how to use it in the future. So as developments in the central role of human emotion developed, the name of EFT was changed from process experiential therapy to emotion focused therapy. So earlier on, it was a process experiential therapy. But because we realized that emotion is a central role in therapy, that influenced the name change. And the early origins of EFT can be linked to Carl Rogers and his person-centered approach. And the basis or the main idea of the person-centered approach is that people are inherently motivated toward reaching positive psychological functioning. So we all want to get to a place where we function psychologically in a positive way, and without it hindering us, and things that interrupt our emotions and getting to the bottom of what's keeping us from feeling things or making us feel things too much. So from Carl Rogers' theory, and after the name change, there's one person that really took EFT and put it into the mainstream and got it on everyone's radar. And that was Sue Johnson. And she is known as the modern founder of emotion-focused therapy. So she was the originator and main proponent for EFT couples in the 80s. So she realized that there are a lot of emotions involved in a relationship, especially from, between a husband and wife. And how can we focus on those emotions to better understand our relationship and work on improving them? And she says an approach that focuses mainly on how people deal with their emotions and how they send emotional signals to their spouse, and then how this emotion becomes the music of their interactional dance. And those are Sue's words. And it's just our emotions really are what kind of spurs the emotional and interactive dance between a husband and wife, and their behaviors that are maybe not coming from what they say they're coming from, but other things that they have not yet expressed. So we need to get to the bottom of those emotions and see where they're coming from and deal with the things that are causing those emotions. And her work with moderately depressed clients with interpersonal problems led to the expansion of EFT with different populations. So now people are looking at EFT and saying, oh, does it work with anxiety disorders? Does it work with eating disorders? Like, how can I take things that were previously, only thought CBT was a viable treatment for, and test EFT on them and see if maybe it's better or worse, or maybe they can be combined to make an even more effective type of therapy. So what populations and situations apply to emotion-focused therapy? Emotion-focused therapy has been good for eating disorders, such as binge eating disorder, anorexia, and bulimia. So these disorders, especially, eating disorders, can come from a place of issues with emotions, and that's how we manifest them. Borderline personality disorder, emotion therapy has also been very effective in that. A bunch of different anxiety disorders like panic, phobia-related social anxiety disorders, etc. EFT has all been effective at treating those. Relationship issues, as we talked about earlier. And how does EFT help us with trauma? What can emotions tell us about the trauma that we're experiencing and how we might be able to lessen or affect that trauma? So there's a lot of applications for EFT. And so what are some of the situations that we use EFT for? We help clients develop a stronger sense of self. So if we're insecure, if we're having emotions around that, we can use EFT to try to help someone have a stronger sense of who they are and just more confidence in dealing with things moving forward. It helps people with the ability to internalize ways of treating yourself. Maybe you thought that being upset with yourself for feeling something is the only way, or you've gotten stuck in this spiral of, getting down on yourself for the things that you feel. I think EFT can help us see different aspects of those things. It can help us resolve the unfinished business and emotions that surround those unfinished business. It can address interpersonal problems between people, couples, loved ones. So why am I being passive aggressive to you? Is it because you did this one thing I didn't like earlier today, or is it because there's been something that's been bothering me for a long time? And that's been motivating the way I've been treating you. So EFT helps really get to the very bottom of things that are causing behavior. And it helps with the development to self-soothe. And an important concept in EFT is being able to self-soothe yourself in order to think more clearly and have a more accurate access to these emotions that we are trying to deal with. So now we move on to clinical applications. How does EFT work in a clinical setting? So we need to provide an empathetic relationship to facilitate healing. And empathy is a huge, huge idea in EFT. And without empathy and without the client feeling that you are sensitive and are really trying to understand the way they feel, EFT is far less effective. We have an exploration of a client's emotional experience and the source of those emotions. Where are these emotions coming from? They may not be coming from the place you think they are. Or you may be expressing a behavior for the wrong emotion and just using it as an outlet. Helps us access new emotions to change old emotions. So if we're stuck in one line of thinking, we might be able to figure out a new emotion that would be more productive for us as far as that. And we need to take a look at what is interrupting from accessing our emotions, what in our life is stunting us. As you know, some people in a stressful situation turn off and don't process anything, and some people let themselves get overwhelmed and just out of control, I guess is the best way to put it. So what's going on with you? Do you tend to use the things in your life to stop you from feeling, or do you allow yourself to feel from those things? And a major principle in EFT is that there must be a mutual therapeutic relationship. Collaboration is very, very important. And the client and the therapist must work together for this to really be effective. And, the facilitation of therapeutic work in general, we need to make sure this therapy happens, and we need to make sure we test it and expand it and see what other populations it can help. So what are some important clinical theories of EFT? Well, I like this one a lot. The goal is not focused directly on changing, coping, or fixing, but on the process of allowance and acceptance. So we're not going to try and change something and have a quick solution for a problem, but we're going to allow ourselves to really feel how we feel about what's going on and accept those feelings and then be able to change them. And I think that's very important to be able to do, to believe that your emotions can be changed and be willing to facilitate and accept the fact that that can happen. And really what a therapist looks for first in an EFT session is this person experiencing too much emotion, or are they experiencing not enough? Are they not allowing themselves to feel, or are they allowing themselves to feel too much? And based on this one observation, the therapist will adapt their treatment process to address those two issues. And ultimately, we need to assist clients to reach a healthy level of emotional expression without too much or too little. So how can we find a balance? How can, when something happens, we have practiced the process enough to not get too overwhelmed, or not overwhelmed enough so we don't think about something and it comes back to haunt us later? So these are all very important tasks in EFT. So let's look a little more at the clinical applications. Empathy. Empathy, as I said before, is very, very important in EFT. It's the fundamental role of intervention used in EFT. We need to feel that people are receptive to what we're feeling and understand what we're feeling and willing to really give all of themselves and all of their effort into understanding us. I think it makes people feel more comfortable in expressing themselves and accessing their own emotions. And a focus is always on the most intense of client experiences. Let's look at what is the most significant for you and the most intense, and work our way down from there. And empathy is also essential in helping emotions unfold. So if you're going to be doing emotion focused therapy, you must approach it from an empathetic perspective. So what happens in the therapeutic process? What do we do when we go into therapy for EFT? Well, we ask the client first, tell us the story of the problem you're having. From beginning to end, try not to leave out any details. Give us the whole picture. And then we provide validation and empathy towards that client. We make them feel understood. We make them feel interested. We encourage the client to focus more inward and deep into their experience. Don't stop at the surface. I feel angry. I'm upset. Go deeper. What else can you determine about the way you're feeling? What more can you tell me about these specific emotions? And we need to be able to observe and symbolize our overwhelming feelings as well. And then the last one in this category is secondary reactive emotions, which are feelings in addition to the ones we're most aware of. So maybe when we have a general feeling, there's other things that are contributing to the way we're feeling. And these feelings are related to other feelings we're having on the same topic. So we really need to try to identify all the feelings that are being triggered by a certain situation. And interventions. Of course, there are interventions with therapy. And a big intervention, or a common intervention, I should say, in EFT is the two-chair intervention. It's when the client takes the position of how they feel and how the person that is affecting their emotions feel. So, for example, if I was really bitter towards my father that he didn't give me enough attention, I might sit in the chair as myself and talk about how my father makes me feel. And then I would sit in the chair with the perspective of my father and try to understand why they haven't treated me that way and try to gain a different perspective on just how it makes me feel. So that's pretty important as far as the two-chair intervention goes. What are the phases of EFT treatment? What does treatment look like? Well, the first is bonding and awareness. We're going to tend to encourage and validate client feelings and give them a better sense of self. We're going to give them a rationale. Why are we working with these emotions? What are we going to do? What are we looking for here? So, excuse me. A rationale can indeed be very important. We're going to promote awareness of how you're feeling inside. Because unless you're really aware of how you're feeling inside, you can't give that information to the therapist. It won't register as much in your brain, and you can address it if you haven't expressed it. And we're going to establish together, the therapist and the client, a collaborative focus. How are we going to work together to get this done? And that, gives the client a feeling of being invested in their own therapy. It gives them the impression that they're also helping themselves, and they're having their own ideas of how to transform their experience, not just the therapist. So the second phase of emotion-focused therapy is invoking and exploring. We need to provide support for our emotional experiences. We need to figure out what the arousal of these problematic experiences are, what's bringing them up, and how we can address how we respond to them. Undue interruptions of emotions. I spoke about this a little bit before. What in our life is preventing us from feeling things? Is it other people? Is it ourselves? What can we do to minimize the interruptions and the emotions we feel? And we also help clients in accessing their primary emotions and any maladaptive schemes they have. And once we reduce their maladaptive schemes, everyone's pretty much in better shape in general. The third phase of emotion-focused therapy, transformation and generation of new emotions. In EFT, we look to generate new emotional responses. We look to take the destructive or the harmful emotional responses a client is having and generate new ones that might be more productive. We're going to promote reflection. Once we've done this work, once we've made progress, what does it mean? We need to think and look back on what we've just done and the information we've got from our emotions and really try to just absorb it into our bodies. And we will validate these new feelings and help our clients come with an emerging sense of self. And that's really important. And contributing to the therapeutic process, I think, helps with an emerging sense of self, as well as empathy, which is why it's such an important factor. Research. The research I covered in this section, it kind of relates to the populations that are effective for EFT. And we're going to look at a couple studies for different things that EFT has been effective in treating. So eating disorders, we talked about that a little bit before. This study looked at the feasibility and effectiveness for EFT for binge eating disorder. And it studied the outcomes of a randomized waitlist controlled trial. So what was the hypothesis? They were hoping that emotion-focused therapy would display a greater level of improvement than people that did not receive it. 21 participants were involved in a 12-weekly 1-hour session of EFT. And this study found that EFT is a feasible treatment for BED, and that people that received it showed greater improvement in reduction of binge eating disorders for those who didn't. So this is a good step forward. It shows the feasibility of EFT as a treatment for binge eating disorder. And the hope is that we'll look at other therapies and incorporate EFT and be able to improve the breadth of the therapy that is applicable for some disorders. Couples therapy, we talked about this before as well. The purpose of this study was to examine the basic assumptions of emotion-focused therapy and how they affect the actual practice of couples therapy. We're going to create a review of the study by examining the process of emotion-focused therapy in different contexts. The themes examined were couples with depression, or the populations rather, couples with illness, and emotion-focused therapy for victims of trauma. And they found that EFT is a specifically designed approach that examines emotions that have been overlooked by many schools of therapy in the past. So we don't have enough information on this. We need to really think about the importance of emotions and how they affect things. Several studies of emotion-focused client therapy showed that it's a more effective method to handle the development of couples relationships and the well-being of individuals in comparison to other therapy methods, schools of thought. And it's also a promising approach for couples partners suffering from psychological trauma, depression, or a physical illness. So in regards with couples, as we see, there's lots of different conditions that can affect couples. And this study was more encouragement that emotion-focused couples therapy is effective, and we should keep exploring its use. General anxiety disorder. How does EFT affect general anxiety disorder? And what we're looking at here is to see if the study looks to determine if a randomized controlled trial that investigates the effectiveness of emotion-focused therapy on GAT is feasible. This was not a study that was run. This is a study that was put together to then be carried out to see if EFT is a viable treatment. And I thought this was relevant because it shows that the discipline is looking and putting together treatment plans for future use to see if EFT is available for other populations. So for this study, they're going to take 60 patients from a counseling service, assign them to 2 groups: clients who received cognitive behavioral therapy, CBT, and clients who received emotion-focused therapy, EFT. And we're trying to get out of the CBT rut here. People that say CBT is the only therapy that works. We're saying no. EFT therapy can be very effective, and together they can be very, very effective, or sometimes one or the other, depending on the situation. So the use of CBT for GAT has been well implemented, studied, but it's had a less than 50% rate of success, which I found very interesting. And this study was conducted with the hope that this study that they put together, that they're going to carry out, will further the study of EFT as a treatment for GAD. So we've devised this study for EFT. We're going to take it out. We're going to apply it to a population and see if CBT or EFT works better. And that will give us information as maybe we can start using EFT instead of CBT. in these situations and better help our clients and not just be drawn into that CBT is the best, because there's theory of thought evolves, therapy treatment should evolve as well. Okay, more research, the chair intervention that I spoke about before. The chair intervention looks at ways that clients express self-criticism, self-compassion, and self-protection during EFT sessions, because we know these are very important, especially when we're expressing problems with relationships and other people. There's a lot of self-criticism and self-protection that goes along, and self-compassion is important. So in this study, they watched 17 videos of sessions containing sequences of clients expressing self-criticism, self-compassion, and self-protection in therapy sessions where this two-chair interventions was used. And what they found is that they reinforced the idea that self-compassion and self-protection are both effective methods in reducing self-criticism in emotion-focused therapy. And results also showed that clients' expressions of self-criticism and self-protection focused more on behaviors and less on emotions. So that's something to think about. The things we do, the things we get on ourselves for, and the things we do to protect ourselves, we tend to relate more with the things we did about them than how we felt about them. That's kind of an interesting thing to think about, and can affect maybe how we approach clients in the future. The integration and application of emotion-focused therapy and music therapy. How can we relate EFT to the work that we do in music therapy? Well, it can help us utilize the gateway to expression that we know as music to provide clients a new language and tool to communicate difficult and hard to access emotions. So we know that music is an incredible way to express emotions. It's a way to convey emotions to other people. It's a way to reduce our own emotions by letting them out. And we can take this and we can use this gateway into emotions to an EFT to apply to other therapies. I think interventions can be designed in EFT that involve physical expression of emotions rather than just verbally. Playing a drum, playing an instrument, even singing are more physical ways to express yourself than just sitting and talking to a client. So I think the physicality of it will be better at helping clients express their emotions. New measures, new types of measurement can be developed in the world of EFT in conjunction with music therapists, let's say in the world of CBT, to integrate the information we gather from music therapy with that of emotion-focused therapy. What can we add to testing and evaluation? How can we incorporate the information we get from music therapy into what we measure or how we interpret clients' emotions? And I think it's possible that that could be standardized and can really affect the practice of music therapy. Music therapists can learn from emotion-focused therapists on how to better interpret and utilize emotions from clients and treat a number of conditions. So let's look at the body of knowledge from EFT. What can we learn from that to better interpret our emotions in a music therapy session and better to affect those emotions? So I think EFT can be very, a good avenue to study for a music therapist to be more in tune with our clients' emotions, which is an important part of therapy. And the more information that is shared between two disciplines and the more research that is done to determine their effectiveness will lead to more effective and better treatment overall. Goes along with the point above a little bit. The more information we share and the more research we do, the more effective treatment will become in the world of music therapy. So I think that emotions are very related. They're very connected to music. They're very important in music. And they really give us a gateway into people's emotions that regular emotion therapy might not. And so the idea of, looking at the research of EFT and integrating it in both directions really makes a lot of sense to me. And I think it's a good idea for moving forward. So why did I choose this assignment? Why did I pick emotion-focused therapy to investigate and learn more about? Well, I've always been hugely interested in psychology, which is what I got my bachelor's degree in at San Diego State a long time ago, because I always wanted to be a therapist if being a rock star didn't quite work out, and it didn't. So for a long time, I felt that learning as many techniques and interventions as possible will only make me a better therapist. Even though I'm a music therapist, I want to have more therapy techniques in my tool belt. If a session calls for speaking rather than music, I want to have techniques in my back pocket that I can use to do that therapy. So I want to not just have to only rely on music, but also have ways to treat my clients that are non-music based, just like paints on my palette or tools in my tool belt, which will then give me more confidence as a therapist. And because I'm a very sensitive person, I was really hoping that studying emotion-focused therapy would open me up to more ideas about how emotions are managed. I'm always working on managing my own emotions, especially with two children, and setting a good example for them about how someone should react emotionally and productively. So I was hoping it would help me with that. I really wanted to pick a subject that I didn't know very much about because it would provide me the most opportunity to learn. So I picked emotion-focused therapy. And I want to see how much I can learn and understand from knowing nothing to the end of my investigation and my research. And emotions and how they affect us and others will be a topic for eons to come. And I was curious to see what was out there already and how I can use that to share with other therapists and just, get a sense of how we can further the practice moving forward and what more information we can add to make the practice better. So this was a great journey for me. It's very exciting to learn more about emotions, how they affect us, how they're dealt with in the terms of therapy, how they can really affect our behavior, and that dealing with our emotions first can be a good predictor of how we're going to respond to them. I think that's very, very important. And I think emotions need to continue to be looked at, continue to be studied. Empathy continues to be provided. Collaboration needs to happen. And we need to work really closely together with our EFT clients to help them get to a better emotional state. So it was a real privilege for me to look into this. References. What are some of the things where did I find the information for this presentation? I found the information for this presentation in a few different places. The first one was this great book called Emotion Focused Therapy by Greenberg. This was a great source that had a lot of great information. I found it very easy to read. And I also found two other books about emotion-focused therapy, the Clinical Handbook of Emotion-Focused Therapy, and a primer for emotion-focused individual therapy, cultivating fitness and growth in every client. As you might understand, there's a wealth of information out there on this, and how it developed from Carl Rogers' theory all the way up to Sue and how she sort of modernized it. So I didn't find that articles were good at looking at specific ways that EFT has affected certain populations, but these sources were better at a bigger overview and providing a good general source to be pick and choose from to get the information I was looking for. So I hope this was information for all of you. I hope it wasn't too boring and fun to listen to. I hope that you're a little bit as excited about EFT as I am. And I look forward to my presentation next week so we can talk about any questions you might have. And I can't wait to see what everyone in the class thinks about this topic. Thank you very, very much. And I look forward to seeing you all.